1, 2, 3, go.
Thank you especially for today. Thank you for this occasion in which the Alumni Association of the Abuja branch is bringing people together for a purpose of information, a purpose whereby the greater majority of Nigerians will benefit. God, we are here in your presence, and whatever we do, whatever we shall do, whatever we shall say, we're asking for your guidance at the end of it, so that everybody here will benefit. In Jesus' name we pray. Amen.
Also, perfect, the guest speaker, Dr. Rasaq, Oyesegun, the National President of the University of Ibadan Association, Dr. MC Berry, the Desk Officer, Cancer, Federalist of my distinguished fellows and chairman of the Independent Moral Practices Commission, and distinguished ladies and gentlemen, members of the Oyesegun family. Greetings, yours. Great. Let me say, it's indeed a matter of great concern, nonsense, who will hear from people about getting themselves when it comes to work. The reason is very simple. We're here together for the purpose of getting ourselves to learn. Because of this God that has been living in our society. And this God, we all know what we cancer. And as an older body, many of people are already informed. We feel it's very, very important that we bring this to the attention of the public, so that all members of the public should know that cancer is not just real, but it is not exactly what we all think it is. There are a lot of myths surrounding this disease of cancer. So we want to see if we do this forum to want to demystify this disease of cancer. Having said so, I would say we of the University of Alumni Association of Abuja, we are the body of patriotic Nigerians who feel that they have a duty to society to contribute to their welfare, no matter how small it is, or it is in society. So this lecture is actually the first of the series of lectures we want to have. After today, we are going to have another lecture. Not necessarily on any issue. Today's series of issue, but it's going to be on that topic. Thereafter, we have another lecture. And for each of these lectures, we are going to invite members of the general public, including those of the here present, to always ensure that we are welcome. We want to say that for today's lecture, we have to rush things up. That's why the notice for most of you was going to be short. Because we face the first half of the year is going, and we must do something. And having organized this session, we think that next time we So we need to apply whatever delay or logistics problems some of them might have don't keep in here for this celebration. Cancer, like I said, is a scourge, but it's not exactly as deadly as COVID is. That's the topic of the next session of tell us more about. But the person who's one of the this lecture was one of us from Reducing for the America. In fact, he was once the chairman of this chapter of the University of Abuja. He dies in just past. We felt because of his contribution to the Alumni Association, we should honor him with annual lectures. We are starting this year with this lecture. Next year, it is going to be on another topic. Not necessarily cancer, it could be on malaria, it could be on education, it could be on everything. So for every year, we feel we should immortalize one of our who has contributed greatly towards the upliftment of our association. There was a young man who, despite his very busy schedule, despite other commitments, never wavered one day when it came to the issue of our association. And for this, we felt that we owe a duty to him to immortalize his name. We are not going to be proud of something that is scholarship for him. But we felt that we can do that by granting attention to this month. This is going to be an annual thing. Every first quarter of the year, we have a lecture that we are going to dedicate to the memory of Mr. Yusuf Yagwe. And we do our best to sustain the legacy that he left behind. And with that, I think we will remember our knowledge of people towards maintaining whatever legacy was going to be. Having said this, I wish to welcome each and every one of us who has found time to be here to this August celebration. I implore you all to listen attentively to whatever lecture that we give you, whatever message you pass across, and take something from. I'm sure at the end of the day, all of us will get anything from this. So once more,
thank you. Let me first, as a chairman, welcome all of you to this occasion by the UI Alumni Association Abuja chapter. Let me join Mr. Ismaila in congratulating the executive members here and the previous executive that sustained this association. I am not really the substantive chairman of this. The substantive chairman was very busy and sent in apologies. I was drafted last week. So I'm being prepared for a typical chairman speech. I'm just going to make remarks off the curve. I opened my programs to be able to attend this for 2 reasons. First,
a topic that is of immense interest to everybody and should be to us, because cancer has a lot of deadly myths. I'm sure the lecturer will help to clarify some of them. One of the most famous myths of cancer is that it is incurable. But I'm sure after we would have listened to the lecturer, we'll know whether it's truly incurable or whether it can be cured at certain stages. The other myth, if you come from our cultures, is that in the cultures, mostly cultures in Nigeria, and certainly where I come from, it is not to go to the hospital. That cancer doesn't like hospital treatment. And when you start hospital treatment, the only direction you go is death. So they treat you to some herbs and other medications. Now, I'm sure the guest lecturer throws some light on that. I also have had a lot about the myth of chemotherapy. Some people think chemotherapy is a curative or a treatment that slows the growth of cancer. The myth, however, is that chemotherapy ends up killing both the deadly cells and the healthy cells. And so the only direction chemotherapy takes the patient is towards the brain. I'm sure the lecturer will help to throw some light on that. But I must thank the organizers for choosing to honor Comrade Yusuf, and particularly to honor him with a thorough professional discussion on cancer, which is one of the things that took it away from us prematurely. I would like to thank the wife, the children for remaining steadfast and for being loyal and faithful to the association. On this note, I would like to welcome all of you again, and I would like to invite the person who will read the profile of Dr. Oyesegun, Chief Consultant Oncologist at the National Hospital. After the profile is presented, we will listen attentively to the lecture. Thank you very much.
is an honor and privilege for me to give this one the honor Congress to Yusuf who was former chairman of this race. I won't further too much to this because I want to go through scientific. I'm going to like to see the I'll give a good definition of what cancer is. Give a brief idea of the magnitude of the problem we are dealing with. And the challenges we are facing are practitioners in the field. I'll give you some examples. Like those four cancers of cancer. And then what can we do to prevent cancer? Because cancer is likely to prevent it. This is not scientific definition, but it's just conveying the definition of cancer. Or control growth cancer cells, of cells in the body. The entire body is created from the smallest of the cell that form tissue, and then the organs, and then the body that we see. Any cell, cancer cell, one single cell, once it starts like this, starts flying very rapidly, and then loss of control. Commonly, cancer should go to a certain stage and die off. Cancer cells don't die. That's not the problem. And then they go indefinitely and spread locally all around the area where it starts. And they have a tendency to involve distant organs like the brain, the lungs, the liver, spread around the body. That is what cancer is. What are the causes of cancer? So first we say the cause of this is this. It means most people are you get it. But cancer is not like that. So we say that the cause of cancer is still unknown. But it has a major associated factor. Now this kind of thing to remember. One is modifying this factor, and that's the one well on the way. The other is unmodified this factor. You are born by your father, you can't say that. Whatever you inherited from your parents, you cannot change that. That's the risk factor that is not modified. But what you have is a component of what you do yourself that you can modify. So we will also talk about that. Another of the cancer problem. The WHO estimated that each year 6.7 million deaths recorded from cancer. And every year there will be at least 10 million new cases worldwide. And presently, or at 10 million, there will be at least 45 million living with cancer. It's projected that in the year 2020, there will be 10.3 million deaths from cancer worldwide. And there will be 16 million new cases and about 30 million by 2020 living with cancer. These actions are taken. And then unfortunately, many of the preventive measures are cost-effective. But unfortunately, even that, they are still not being implemented successfully in all countries of the world. Incidentally, cancer shares of all risk factors with other chronic diseases like cardiovascular disease, stroke, diabetes, mellitus, chronic respiratory disease, alcohol dependence, and some other infectious diseases like hepatitis, HIV, and AIDS. They share certain common risk factors. These factors will come to the picture. Among these risk factors, the modified ones are one is tobacco. Tobacco use, for example, account about 1 million, about 1.5 million cancer deaths per year. Tobacco use alone. And then the food, the diet, and we eat low food and low vegetable consumption. Also contribute to overweight and obesity. This is a function of what we eat. Food generally in this part of the world, contain high carbohydrate diet. And we do less exercise, we don't burn them as adequately as we should. We have chosen given physical hypothesis. So at the end of every day, accumulate much more portion of those things. And so most of us are busy generally now. I'm here. We will say sex. As well as physical activity. I mentioned that physical inactivity. We don't do exercising part of our life. Just eat, do sit down, go to bed. Globally, this is for the fact, not the nation. Cancer alone is one of the ways of tuberculosis and malaria combined. All the malaria, HIV, AIDS, money, especially money to do with that. But there's less money to do with cancer. Yes, cancer is more than all these things combined. And sub-Saharan Africa, that is the world traditionally, Africa itself divided into three. The sub-Saharan Africa is black Africa, excluding South Africa, because South Africa is the first world, and excluding the North Africa. Because they are both statistics, they would not have differ from that sub-Saharan Africa. So sub-Saharan Africa will refer to black Africans. We have access to less than 10% of the global cancer resources. And yet, the cancer burden we have, 80% of the cancer burden is afflicted of sub-Saharan Africa. So, globally, 40% of cancer that is tobacco, diet, and infection. But you can see the disparity in the rate when compared to Sub-Saharan Africa and the European countries. In Sub-Saharan Africa, infection is still the highest contributor, followed by tobacco and diet. Because Europe is tobacco, the highest infection. Agriculture, that's the key to cancer prevention. It's not as cancer is deadly as such. But the problem we have in Africa generally is that patients present very, very weak. At which time doctors are helpless. Most of the time. So what these cancers are detected early, a lot of cancer are curing. Even when they are still curing. So how to detect early as with screening asymptomatic patients like you and I. We are not having but if you screen routinely, you can actualize that and leave it before it manifests. But screening population, screening the live population is still not yet for society. And so once there is screening, patients are treated and the cancers are detected early, then you can cure. Because eventually the actions of cancer are curable. The other countries are still in. For example, we will not hear of cancer of the cervix. That's the threat of the womb. Killing women in Europe. They are going to find out because there is an infectious system by which women are not needed to go for screening every year or as sensitive infant. So everybody is like to ask you to send early or before the base of the group. So women are not dying of cancer of cervix group. But yet, it's still the greatest cancer rate, also cancer rate. Essentially, a third of all cancers are prevented. A third can be treated if detected that goes early. And unfortunately, a third of all cancers constitute more than half of cancer death. But like breast cancer is the commonest cancer in women, and prostate cancer is the commonest cancer in men. So I use this one to illustrate. For example, this is breast cancer. I hope you can see this on the right side of the womb. This is the cancer affecting the right breast. The entire right breast is involved. This is what called stage 4, T4. T4, that's the entire breast is involved. And this is what is tiny logo. And that's why you are going to this side. The things that we got for more than 2 years. This is another one. This is also T4. You can see the tumors protruding from the skin. This is what is protruding from the skin. This is another one. So this one, this is the entire breast here is involved. There is not a clear picture. The entire chest wall has been eaten up by the cancer. This is another one on the left breast. Formation. The entire breast has been taken off, taken away. This is the foundation on the breast, on the right side. This is another one. And this demonstrates a stage 4 breast cancer, that's stage 2. That's 2. Coming down here. This is after neural evolution. It's already affected the lungs. So there's fluid in the lungs. The patient cannot breathe until the draining. This is stage 4 breast cancer. So this type of patient, they have to take time because this is what we want to do of what we see every day. Okay, so I don't know that I'm showing here on the screen, but the two breasts are involved. This is another one, I'm not forgetting one. This is inflammation breast, the entire breast is involved. This is another one, the entire right breast is taken over by the cancer. This one is not a patient. This is another one, non-patient. So, what is the peculiar of breast cancer? I will see. So, unfortunately, most of the patients are not patient. The youngest patient I've seen is in Nigeria. And most of the patients are in their 30s and 40s. This is what is wrong. You are made like my soul. But what we see in Africa, we see cancer which may develop. And one of them is ending very late. And unfortunately also, in Africa, there's a class of kind of breast cancer that's very violent. That's the one we suffer from. Very violent. And cancer as well. And the leaders say, treatment of any of cancer is expensive. Extremely expensive. We say for house, we say for marriage, all of us say for cancer. I mean, you ask people there, what would happen? I don't want to have it there because we have this everywhere in the building. I would rather choose them. So nobody chooses to clean. So when this thing happens, the entire family, the family, and there are not of them actually quietly die. Until recently, we tend to believe that, or tend to ask the situation. We don't have statistics about what is the incidence of cancer in Nigeria. That has hampered a lot of things. But some workers, assisted by as comprehensive experts, came up with reports. I mean, they established cancer registry for us, both institutional based, hospital-based cancer registry, as well as city-based, those are the population-based cancer registry. The two population-based cancer registries are one in one, and that of these, last 10 years, incidence of cancer is doubled. That is an indicator of how severe the problem is. Why do patients present late, like I'm reporting now? One, well, we don't have organized screening system. This is not organized in Nigeria alone, generally in Africa. But unfortunately also, what is found population is not of religious beliefs. Some of these, as I said, start very early. But we have this attitude in all of Africa. People deny, the attitude of denial. It's not abortion, just make, I hate it. Devil is denial, I don't want it. And then, it is there. And they keep it, and they keep on progressing. Some will go that, oh, I mean, I'm radio television or radio program once, and then it's a phone program, all kinds of money, and said I did not know what I was talking about. Breast cancer is actually spiritual disease. Only when women dream that the husband is devil and the husband is not touch their breast, that's when they wake up with develop breast bomb. So we also saw breast women all over the place, and it's supported with spiritual. The law was not going to allow me to say anything. Eventually, we had to come up. Sorry, we lost the ball. So there's a lot of strong religious dogmatism surrounding most of these things. So that at the end of the day, most of the actual senators when they are about to die, they don't want people to die in the premises. That's what they say about. Otherwise, they keep them praying, and they still keep on growing. So, and again, it's poverty related. And I said, to treat breast cancer, because of that, where we have what we call anti-new expression. Sorry for the word, but this is because of that. It's very common among our patients. And the peculiarity about it is that it is not a particular type of chemotherapy. But this chemotherapy is expensive. To treat it, the patient will at least 6 to 8 million to treat it effectively. How many Nigerians can afford 6 to 8 million? If I know what, we will need 100,000. That's what we tell them now. Let me buy one guy. They can't see where they go. There are many people who can effectively, for example, effectively, the patient that can effectively treat our 2 new or express patient are only treated maybe 4 successfully. Most of them never go to another afford because of the 2 million, 1 million, don't talk about it anymore. And also, no level of awareness. Yes, because I still no level of awareness in any rural areas. A lot of people will mistake or will take breast cancer to actually be boiled or something like that. Apply Vaseline and also things or until it becomes very late. And the usually is also a contribution, not very good. Because most of those people in having cancer is not because of the lack of information, it's because of the strong religious belief. And often also the prayer, someone like using faith, and saying that when faith is the factor of the fact that he or she is poor, and not that the kind of faith we're talking about. So rather, what we will say, at least, if someone tells you, there is nothing God will do, who say, no, there's nothing God will do. So if someone will do that, also, not that, yeah, it's true, there's nothing God will do. But what are the causes? Like I said, those are common genetics. Breast cancer is familial disease. It runs in the family. I know families who have 3, 4 women, same family that died of breast cancer. And that if you have that hereditary tendency, you cannot provide it. You cannot do anything about it. But you can modify all these other factors, like obese. People with discovery in women who are obese, you can modify that. You can modify your lifestyle. Direction, discovery in people who drive alcohol, blood. For other factors, those mistakes, menstruation, headache, like this day, I gave you this day, start menstruation at 9 a.m. screen on a specific day of the month. I mean, let's say the menstrual 15-day menstrual cycle. Because when it was the end of the cycle, when people are expressing that there is this fullness, rest, expression, preparation for pregnancy. Because the body of the woman is for pregnancy every month. And the one that is not pregnant, because there is pregnancy, is not. And then, but when the nurses is abortion, the breast is usually full, and that's not the kind of preparation. They need people of the woman, the ones that is not. We all look at the breast, check the labels, normally the labels point out if it's only the ones that are there, or the breast is blood is coming out. Normally the breast is label should be one of the colorless if blood or something but there's a lump in the breast, painful lump. That is painful for men. Lump is not, breast is not the problem of lump exists. Any lump in the breast was normal. Or there's a swelling in the breast, there's a staining alarm, or there's a lump that you are facing either in diabetes or something. This can be taken by the human concerned herself or by the spouse. So this is a situation that we don't by either of the two. This is awareness lesson so that we don't have laws or we compelling women to do them. Because these are the ways by which breast cancer can be screened. That is that much about breast cancer. Prostate cancer. The prostate gland is one of the components of the reproductive system in men. Like I said, prostate cancer is the greatest in our men these days. The prostate gland is not on the surface, it's just behind the bladder, so it's not on the surface, and it's also close to the rectum as well. Prostate cancer, screening for prostate cancer, also what we call prostate specific. Prostate cancer, for example, are seen in men as young as 40. So not most men are here beyond 40 years old. So when you are more than 40, you should start screening for prostate cancer. And if it is less than 1 actually, the normal range is usually 0 to 4. If you do it in a particular year, and it is less than 1, then it is not necessary to be repeating it every year. Maybe you just every 3 years, every 4 years. But if you do it first time and it's 3 or 4, that's not how you do normal. Such individual should be doing it yearly because we don't know when it will start rising rapidly. But more often than not, most of us don't do any form of screening. And what are the causes of prostate cancer? This is also one cancer that is familiar in nature. It runs through families. I've seen families where all men are all killed by prostate cancer. Their 60s, their 70s, all of them die of prostate cancer. So this one runs also in the family. But we do something about all the other causes that are listed here. Like the rest is commoner in blacks compared with the whites. And it's more virulent also in blacks. The type of prostate cancer we have is also is better. The cause of this we still don't know. The environment we live in, the exposure to radiation, effective agents, previous use of benign prostate disease, and they are also protected. How does it present? Prostate cancer can actually be asymptomatic, like this, you don't feel anything, just go normally, but maybe you just go for PSA. Just, someone said you should screen, and say your PSA is 80 or 28, it's white. And it should be more than 4 actually, in the normal circumstances. So there are other causes, and then you just act like that. Or doing routine tests, or doing rectal examination, maybe you complain of bleeding parenting or something, and you look at the finger into your rectum, and someone like, prostate feel abnormal. That would be a almost asymptomatic. And then, of course, the symptoms, frequency of nutrition, as having a weight And we also present credit, which was part of this blood coming and expand. And also very hey, that would be presenting symptoms, especially in the area of 70, 75 years. But we have to appreciate that way. Then once you go to the screen for process cancer. So I can tell this is the service. That's the role. This is the role. This is the service. And this is where cancer starts from. And then it can spread upward, this way or this way. So cervical cancer in the area is the second called cancer. And the second cause of cancer in women. People go to disparity from region to region. But generally, the second. But some parts of the world is still commonest cancer. And some parts of Africa too, like Gambia, Zimbabwe, Nigeria, most of these sub-Saharan countries, we see commonest cancer in women. So we don't prepare for the day. This cancer is very preventable because, if it's not like I will mention later, it's just random organization that everyone subjects themselves to once a year. We still need to have the incidence of cancer of the but just all women having organization, but not everybody got them. Even the midwife do organization like this. This is because it's really available, because it's very accessible. And still, as we talk, the majority of them still is very big because people never know. They go to subject, it's a privacy and very privacy. But I don't think another woman, especially a trained person, is handling another privacy, the issue of privacy. But like I said earlier, it's not because of mortality. We know that was because of safety and the screening pattern. And so they need it to be done. And also it's associated with some infections like coronavirus. But the good news now is that people are developing vaccine to this infection. Because now, cervical cancer is widely regarded as essentially affected disease. The reason is this: you don't see cancer of cervix in people who engage in sex. Like Catholic monks, because you don't engage in sex. So, this is the difference for those who engage in sex. That's just 10 days in the but there's vaccination is now being restricted right now for young people, but still not yet widely accessible. There are about 50,000 cases of cervical cancer reported annually, and 8,000 of them, more than half of them, will die in Africa of this disease. Whereas it doesn't mean anybody else in Europe. But the reason for this is that most of our population is very big. And instead of 50,000 and 3,000, that's what they said earlier. And they said that every 27 minutes, a woman in Africa dies of cervical cancer. This is our common disease. How does it present? They might be postnatal sex, that is, a woman who is normally starts bleeding, because of Africa. Or places now, they start bleeding again, or losing blood, every day, different type of blood, which is anemia, or most of the some was not places, all the rest, and start bleeding, so I start bleeding again, that's the kind of situation. Because of that, it means you are not having one day. But if you get another ministers, then you should be restricted on this side. And then the last case is when you have heavy pain around the body. That is disease is very advanced. It means that the body side of that body. So every time you do bleeding or physical condition that is when you begin to bleed, you need only go through another hole in front. Or if you start coming with the and that's the condition of cancer of the cervix. marriage, children, that means one is exposed to intercourse at the stage where we are learning or we don't know still not yet assured and at the stage of our life, such that this stage we dispose to. And then marriage is also another women who have men, 7 children. Constitution, this are most visible the constitution goes for living. I'm not living with our spouses, our consorts. It's one of them. Leisure factors, blacks, versus whites, and circumcision. It's lower in provinces where men circumcised compared to the issue of the same that is severe, not Jews, because the tradition of the Jews is circumcised. So it's also there when it's general. And then socioeconomic group is common among those socioeconomic group. Because women they are not empowered to determine who their spouses are. Always a positive, I mean, because one is the job, I say, of religion, to something, for something, I got the right to do about it. And then most of these social people, because of poverty, it's a for anyone that can afford it to do something. It's also related to divorces and separations. Like I said, a substantial portion of this matter is affected by financial examination. Simple financial examination. There are other examinations that have here or visual inspection. These are actually slightly technical. But the simplest one is for women to have the exam once a year. If they do this, then they can live instead of this in the world. Because those who were examined by someone who is competent, if he sees anything abnormal, he knows what to do next, or he knows or she knows who to refer you to. So, just simple financial examination can prevent a lot of that sort of stuff. And then, colorectal cancer. This is the colon, the large bowel. Starts from here, all that. It's a very long time, 2 meters long, and have different segments. And not any of these segments cancer at all. The peculiar thing about this colon is that it's a highly sensitive organ. With half of the diameter of the right, you cannot feed them. If you try to feed it and survive half of the diameter, the patient cannot feed anything. By the time the patient starts to feed, that is the big organ of the brain as the right. That is what's so a lot of patients with colorectal cancer tend to prevent it because the people, it's like bread cancer. The ovaries inside the children, the abdomen, and that's the big hole for the cancer to play with. The same thing here, and the second, as cancer is going to get the second, we still process it normally. Then the same problem is happening to the blood, stool, mucus, stool, or constipated, or like that kind of constipation, diarrhea, so constipation is disease will go too far. The latter one. But the confirmed one, the diet. These are the ones that we confirm. Take high fiber diet, high protein consumption. These will enable you. For example, most of our food, most of our food in Africa, everything like so let's suppose you have very rich. I think there's some of these, for example, take one banana in the evening. Saturday, the whole of that, but following it was good for it. And it's a head habit to put about every day. The one that is all this frying food, they spend a lot of money on that because most of this man don't enable you move about everything. But they spend a lot of money on that move about. Or we cannot afford 2 or 3 square meters, and then we want to buy them. We are changing our life saving. That's not our then you are telling lots of weight, lots of guys, and the balance cases pay back. But that is happening is far too long. And some of them are even at the same time, they represent liver cancer as a starting point. And once you have that, it means no more glory. And I think that so many people into the women is slightly technical. But in countries where liver cancer is common, it's common in Nigeria now. There are situations for where this should go. Annually, if you win a particular year, you know, automatically, then maybe you push the line. But if there's automatic, you follow up. There are certain measures for actually all of us. So, prevention in general, what can we do? Like I said, there is this question of cancer but we can have familiar tendency. And then, if not modify risk factors, not also contribute, you might not have it. You have familiar tendency. You will never have it. Because, for example, it's not everybody that smokes and develop lung cancer. Some people don't have the tendency to develop. That is the we don't have it. But more often than not, if you smoke for a couple of times, years, those are the results you are likely to have lung cancer. And for that, smoking, as across all everywhere, smoking and medicated. So that is why most of the countries now, smokers or more than people, you don't smoke because they're exposing others to smoke. Because not only when we are holding mistakes that we are smoking, there is passive smoking as well. There's always smoking in this room. All of us are always smoking passively. So that's why smoking is not because people hate smokers. Because they expose others to smoking. So, if you are not smoking because of modify our diet, like I said, our own food don't have the ability to feast to life and not only one also. We will not ourselves of food. And then control maintain a healthy weight. Most of us are overweight. But actually, the fact that we eat more than what we want. If you take sashimi every day and then involved in exercise every day, and go again for any of the you discover this obesity. And these are reasons factors. So exercise regular is one other thing we are not doing very well. I put this one here because a lot of people now to acquire most of these machines that we use for exercises. But it's also you can see that it's
my name is Fadi Dele, and I'm a member of the West of the Association of Abuja branch. Dr. Oyesegun, sir, I really enjoyed the presentation. More praise to you. My question is, what is the possible cure for hemorrhoid? Because you mentioned hemorrhoid in cholesterol cancer. Does it actually have a cure? And what is the cure of cancer? So far, so good have told us the cure, does that mean that cancer does not have cure at all? That's my question.
My names are Engineer Kasim Olamolewaji. Thank you very much, Dr. This lecture. We really enjoyed it. But the question is this. Having scanned through the presentation, sir, I look at a situation whereby you spoke about the poverty level of our people. We need more education about these things. And we know that looking at the indices of Nigeria, that people are very poor. Looking at the ratio of poor people to rich people, maybe the ratio like 10 to 70, and people are very educated. Will it be possible, as part of government policy, to inscribe this kind of
maybe free screening for people as it's done abroad. Because some of us enjoy listening. The first ever screening I did was abroad because of certain reason or the other. Because then I was taught I don't have some. But there was quite a lot of people that don't have money, but they are living with this cancer. So there should be a government policy in place that will really help the masses on this.
Thank you. Chair Accountant and alumni of Jaja. I want to thank the resource person for this for the lecture. It's very expository and educative, and it's coming at the right time. But my question is, in the course of your lecture, when you were discussing ecology on the breast cancer, say it and one can get infected. I wonder how one can get infected now. Thank you.
My question is this breast cancer. My auntie experienced some years ago. We discovered that there was a little lump in her breast, and in order to operate it, she refused. But later on, the lump, they don't remove only that portion of the lump, but they wanted to remove the whole breast, but she refused. But later on, the lump came back, and this time around, they now removed the whole breast. She went into chemotherapy and eventually radiotherapy, but she still died. So, what is the earliest stage that we can have to get to detect cancer? Is it when the lump just came out, or if we go for the screening, that way we can detect breast cancer? Thank you.
Question is this. You made mention of ladies on their menstrual cycle. That maybe some ladies they normally have some hormones. The pregnancy hormones are being secreted, which at the end of the month there was no pregnancy and to shed off by menstruation, by the blood. So, sir, how do we examine? Because in terms of before the menses, I think the breasts, some hormones are being secreted. So if you touch the breast, there are some lumps you feel there. You feel the lumps and the heaviness. So after some times, the lumps do come down. Then how do we differentiate the cancer from the lumps that are being secreted during the time the menses are about to do? So I want to know that. Secondly, sir, you made mention of we taking less fiber food. So how do we know the less fiber food? Because in this case, almost every day we eat curry, we eat semo, some people we eat semo because those people does not contain high fiber food. Then we eat indomie. It's a use of food. So, and there are many kind of foods in the markets. So how do we know the kind of food and the best fiber food which we can eat that will not grow the cancer? Thank you, sir.
Thank you, Doctor, for the lecture. My question is similar to what my sister had just asked. Because these days we find out, especially ladies, that we don't eat Nigerian food again because we don't want to go out of shape. We don't want to be bloated. So can you please elucidate more on the kind of Nigerian food that we can eat and make healthy? Thank you very much.
If you have the best thing to do is to visit your doctor. Or more commonly, the final cure of the mind is mostly surgical. Remove it. But one thing is, looking at the surgeon who can tell you this is hemorrhoid, this is not hemorrhoid. Like I said, there are many things that can be like hemorrhoid that are really not hemorrhoid. So it's only by visiting the doctor that's really important. Cure is still surgical. Cure of cancer. This is not true to say cancer as of now has no cure. No. So many cancers are curable these days. So many of them. Because it's a function of what we refer to as cure. For us, in some cases, if you are treated for a particular cancer, 5 years after, 10 years after, 20 years after, you are still cancer free. You need to up. As a concern, a lot of cancer can be cured these days if they are caught early. The problem with us is we don't detect our cancer and our patients don't come early. They come very late. That's why most of them are dying. We say if you know it from the beginning, like I said, 3/4 of our patients come very late. You know there is really nothing you can do. But all the same, we still give them all the necessary treatment. Because what is wonderful? Even these 3/4 that are presenting it, some of them will still survive another 5-10 years against all expectations. So that's why we still give everybody the benefit of that. But cancer is curable if patients come early. But the infection thing is not very prominent with breast cancer. The infection is prominent with cancer like, say, cervical cancer. That is the one that is sexually transmitted. But with breast infection is not very prominent. And there was a question about the patient who had mastectomy, and patients still died. Yes, you mentioned this was initially at this time. They wanted to remove, she refused, she went away, and later there was mastectomy. The way we treat breast cancer is it's not a rule that every woman that has breast cancer must lose the breast. No. There's no such rule. But what we see in most cases in our environment is such that it is almost always impossible to do conservation of breast for most of our patients because of the volume of disease that they come with. If the breast is this big and half of it is occupied by cancer, it is not going to be possible to conserve that breast. It's not going to be possible. So that's why most people, the best way to detect breast cancer is if a woman with a lump on the breast, that is the time when it should be removed. Not just removed, the woman must insist that whatever is removed is subjected to examination in the laboratory. Because they might look the numbers of the breast. You see this times that number. Not the collection in front of the patient. The patient said the problem is removed, or somehow, along the line, the tissue girls listen, or someone did this submit it. She wasn't told to submit it for examination. Any tissue that's removed from anywhere in the body because of sexual cancer must be subjected to laboratory examination to be sure that it is not cancer. And if it is cancer, that is the time action should be. Or if this is not done, you have a cancer and the thing is thrown away, then 1 year of the cancer come back full renal. That's the question. So the time to take the breast cancer is when the woman gets any abnormality in the breast or any bone attention. But the problem with us is that when this attention is sought and is confirmed with cancerous institution denied, the result is initial attention. Because that's basically the doctors are really not in charge in this country when it comes to most of these things. And the more often than not, the pastors are in charge. They have more focus, they have more listening, more people listening to them. So if the pastor says, go by faith, you are cured, that is it. They will come across again. So we all have a role to play. So some of these patients are taken early. But likely poverty, likely because of usual education, they tend not to follow up with further treatment. And cancer, the one that if you don't follow up with further treatment, is likely to be fatal. So that's part of the problem. After the crisis, when everything has settled down, that's the best time to. And then to do the examination has to be regular. Every 7 days after basis, every 10 days after basis. That's the regular like that. And food to eat, we all know what, like I said, our food, and I will mention our own food only. I won't mention other food. Pepper, abala, these are the you see fruits, how much of fruits? Landlord, watermelon, guava, all of fruit. If you make this much, this picture that if, for example, what you are eating is the same color, you know you're not eating right. But if your food contains black, white, red, green, all sorts of things, then your body is like, well, it's just white and red alone, or black and red alone, your body is not balanced. But like I said, you have a lot of food environment, and they're not necessarily very expensive. Even in the bush, you regulate. They eat better food than what we do. For example, when we were small, in the village, when we go to the farm, we eat yam with palm oil alone. And if you eat wine with yam and palm oil or with mushroom, these are very balanced. And palm oil, our whole palm oil, is known to be protective. It contains agents that are protective against cardiovascular diseases compared to all this granite oil we are taking. Palm oil is known to be healthier. But the risk of most of these things compared to refined oil. I think I'm able to answer all the questions.
Thank you very much. Let's give it a Dr. Oyesegun, we haven't quite finished with you yet. I'll come to the high table now. Our members of the high table to make some comments and ask a question. I'd like to start with the National Coordinator of the Cancer Control Program and Head of Nuclear Medicine Program, Federal Ministry of Health, Dr. Rasaq. She can make some comments and ask a question as well. Thank you.
Thank you, Mr. Chairman. So the question is more of a comment or a number of comments. First of all, screening. For most of us, we hear the word screening, screening. I want some of us to please translate that as equal to going to have a medical check-up. And please, you do not need a ticket and an airport to have a medical checkup. No. Most of our hospitals are equipped to give you a medical checkup. Example, you go into a hospital asking to have your blood to be checked. The doctor will understand that. And of course, if you have cancer like leukemia, through a blood check alone, it will be detected. If you say that you want a stool check, they would, and especially if you say you want to be checked for cancer, it will be done for you in virtually most of our labs, whether teaching hospital, general hospital, because most labs in the country are equipped to test for occult blood. For breast cancer screening, it involves a nurse or a midwife to be allowed to check the woman's breast and to teach the woman how to do it for herself at home. So when we talk of screening, they are not talking of something strange, fantastic, that is not doable. We are just telling you, please invite the habit of going to hospital because you are well, not when you are sick. If after Dr. Rasaq has done this wonderful lecture, and we carry this home with us, I know we would have done him a lot of justice. Now, secondly, concerning you, yes, cancer is curable, like you said, and I congratulate you, which I should have done when I started talking about
procured. But unless you present yourself when you are well, for it to be detected early enough, it cannot be cured. Of Nigeria, for which reason I came and am invited, and for which I am grateful to the organizers. We are concerned by the terrible statistics that have already been mentioned as part of the lectures, and for that reason, the concept of awareness, the concept of immunization, especially against cervical cancer, is being vigorously introduced by government and injected into the public so that we all now begin to know, one, cancer if detected early is cured. Cancer doesn't come from the witchcraft or from an enemy or wherever. It is something that happens as part of a disease process. Two, we have therefore been able to set up screening centers, especially for cervical and breast cancer and prostate cancer, one in each of the 6 geopolitical zones. The nearest to this very well we have is at Federal Medical Center, Kebbi. We have also centers at Federal Medical Center, also FMC, or Abuja, and in Bauchi, and the Alumni Teaching Hospital. If you listen here, you will find that these are semi-urban settings. We are not going to the big cities. We have placed these centers strategically so that women, as much as possible, down the level of higher class privilege. At the same time, 9 hospitals have so far been equipped with radiation therapy equipment so that those that are severely affected, which are now the kind of people that were native in hospitals, could be treated very well without the need, as is previous, to go outside the country. In addition, we have gone into training of oncologists, of medical physicists, on radiographers, and we are about also to start training oncology nurses. Why? So that we have enough staff on the ground in the country to be able to attack this scourge that is really affecting us as a nation. And of course, there is also hope for the hopeless, which is what is called palliative care. For those patients that have been so badly affected that there is nothing anybody can do for them, we have what is called palliative care. And many hospitals, including the National Hospital, are offering that kind of care, and we have NGOs and private settings that are also into palliative care. And government is doing a lot of that part by setting up training centers that will train palliative care nurses. That is nurses that will only specialize in giving that kind of care. As involved in cancer care, I'm so excited that we have a distinguished senator amongst us, because once there is a law that says that should happen, the Federal Minister of Health will jump at that chance. Because the NHS would now need capacitation by way of funding, as well as capacitation by means of enactment of the law that would allow them to operate accordingly. Once these are in place, we should be able to offer what is being asked. But for now, a lot of patients affected are piloting themselves through. What do I mean by ancillary? Pain relievers, imagines, antibiotics, because once you have cancer, part of your treatment must have all that in the list of drugs you have are yet to be covered. Thank you very much.
Thank you very much, Dr. Rasaq, for that very educated explanation, which I'm sure has gone very well with our colleagues. May I ask our chairman, if there is a comment to the question?
Chairman of the UI Alumni, distinguished boys, I am very happy to be here with you because I got the invitation to attend this Friday at the Expo wanted to pay us. And I said no, I would rather come to the lecture and then we can also do the gospel together. Thank you very much. Cancer was going on. I knew I was in the right place because the description fitted perfectly the definition of corruption. When you have cells that take over healthy cells and corrupt cells that do not have the boundary, and affect other parts of the body, just like we have corruption affect other parts of national life. I knew I was in the right place. And when you started giving the statistics, it also looked like the statistics were used. When you say, and somebody raised the issue of before, it appears as if you don't have a cure. Fortunately, no matter how widespread our own constituency is, I'm sure together we can have a cure. The statistics show clearly that the major effect of sub-Saharan Africa. When you make a relationship between that and the indices of development compared to other parts of the world, the same area, sub-Saharan, has lowest indices. And we have generally fingered the lack of institutions driving development as being responsible. The lack of institutions can also be a good relationship with corruption, who have refused to do what they should do. And he gave a very potent example which we all laughed but not know the seriousness of it. When you are told by a religious leader in quotes that you do not need to go to the hospital because these issues can be solved by prayers. It was so prevalent in one part of the country that the government had to make a pronunciation over that. I'm sure you know that quite a number of these mushroom unregistered religious bodies run maternity clinics. Yet, the followers of those people have never seen the wife or the children of the pastor coming to those clinics. Never. And they don't take the lesson from that. So, on the basis of what I have learned today, we need to make a certain effort of building future immunity in our systems. If anybody puts himself out as an expert in a field that is obviously not his, able to bring such persons immediately. I would like to inform you at this point that this is what has happened in our regional center, where you have people setting up the awarding bills in areas that are not experts and not registered. Many years ago, we listened to the police and it appeared as if nothing could be done. When I came on board the commission as the chairman, I said that two sectors will attract my immediate attention: education and health. As I speak to you now, over the past 3 days, we have effected the arrest of most of those persons who have been running these people to really awarding bills. They are seizing their properties, they are seizing their accounts that you can find in banks. And we are going on to distribute each and every one of them that they can sustain a peace against. Immediately was that he claimed to have finished from the University of Ibadan. That is the level of impunity that we are trying to see. People have been hearing that advert, but nobody took any exception to it. You see, the poor rely on whatever is coming out from the radio or from TV to be true. Because if it was not true, the authorities would not have allowed it to be said. So I immediately called him when he gave his number, and I said, "You finished from the University of Ibadan?" He said, "Yes." I said, "Which hall?" He said, "Okay, that has nothing to do with my treatment." I wish it was now. But you also must be on the lookout for situations like this, so that the moment anybody gives false information like this, bring that to the attention of the relevant officers. Offer suggestions that they are not technically or professionally competent to do. The second aspect I would like to mention, when he was making suggestions, he said your partners actually help you detect things that you probably would not have noticed on your own. Once again, maybe you're lost over that. I think it's very important that you should be able to understand the physiology of your partners. A husband might detect the breast lump faster than the wife. I'm sure the wives will agree. And wives might also discover lumps in their husband's presentation. And I hope that it will not end here and that what has been said today will go on to the website, you have a website for others to access. Thank you, Mr. Chairman.
Thank you very much. This is a very enlightening intervention. The last contribution, which will be by way of a comment and later the vote of thanks, shall be delivered by Dr. Oyesegun, Chairman of the Alumni Lecture Committee of Abuja. But before he comes, we have the National President of the UI Alumni Association, who shall make his intervention and give his short address. Thank you.
But before then, let me appreciate our best lecturer and thank him for a beautiful lecture. Joining that to the comment, three things came to my mind. First, each of us has a responsibility for cancer control. And like the pastor said, all you need to do is walk into any hospital and say, give me a checkup. Whether it is high blood pressure or diabetes or cancer or whatever, go for a checkup. From one, we might be able to achieve the other one. That is what each and every one of us owes himself or herself. Have I made myself then? Did you hear that? Yes. Number two, our mothers should please train our children a little better. There is something like my child does not like. There is something like my child does not like Gary. In my house, so long as you are inside that gate, you must eat Gary in the afternoon. If you want to eat a yam with a goosey soup, no problem. If it's a goosey soup, no problem. It has to be a swallow. If you are not prepared to take a swallow in my house in the afternoon, you are not welcome. If you are not like this, and you are my son, you are my child, and you are my compound, you must eat a swallow. When you go to Lagos or Abuja or London, like in my house, you must eat that one. So please, mothers, this spaghetti, this Oyesegun, they are not the answer to our dietary problems. You eat too much spag, too much indomie. To be in 10, 20 years time, it's not just today. Sometimes we have mothers who say, my child cannot stay in a room that has no air conditioning. I don't understand that. Open the windows a bit. Make sure the child is well wrapped. He will sleep well. So long as he's not hungry and he's not present to go to the toilet, he sleep well. Train the child, not the child control you. This is something basic. The children are controlling our parents too much, and that's a part of the problem we're having. When they get used to controlling you, when you begin to ask questions later, what's going on? Why didn't you ask questions earlier on? That's number two. And number three, and last and serious. Government should please come in and do their bit. I'm happy at the facilities Dr. Rasaq has told us about. Unfortunately, many of us may not know about them. But we can still access them if we go through the primary health care, the private hospitals, the general hospitals. There are doctors there. Before you go to the teaching hospitals and the FMCs. Of course, we are also expecting that the anticipated health care will address some of these things, including legislation, for screening for prostate cancers, high blood pressures, and spinal cancers, and so on. So until then, we should begin to help ourselves. So that will be my brother. Thank you very much. God bless you. I've distinguished students very, very well at Senate for 8 years. And if you want to know, we monitor your performance on a month-to-month basis. We did not let us down. In 2005, despite your very crowded schedule, we came to Treasure Hall and gave us a very, very beautiful lecture on education. It was because of that, and because of some of this, that last year, in our collective decision and wisdom, we decided we had to appoint you a member of Board of Trustees of UIA. For ease of operation, we say you'll be controlling the northeast zone of the country, because we still know that Adamawa and a few other states around there will begin to show more pressures. In fact, there's a chart respect, sir, since you go there from time to time, you will encourage the formation of the branch in Adamawa and chapters in Adamawa. God bless you, sir. You have done wonderfully well. Abuja is the center of excellence. Abuja goes and the rest of us follow. You show us the light. You show us the way. A few years ago, we had reasons for you not to be present. We felt very bad. And some of us prayed and worked and wished and begged for you to come back. Now you came back in full force, and your presence has been very, very felt. Thank you very much. I will tell you that you have the mind to recognize one of our brightest and best. He was my friend, my in-law as a matter of fact. That's why when I see some of these girls looking at his man, they don't look at me. I don't know what they really wanted to do. Because as I first allowed the issue of your vision and in Abuja to spoil my own business. But I'd like to appreciate you, my brother, for you to recognize your predecessor is a great strength of character. Your own successor will also recognize you. And God will bless Abuja by recognizing you. I thank you very, very much. Now you have 3 chapters in Abuja. I know you are working hard to get more chapters. Our fellowship with River State branch in Port Harcourt. Our fellowship with Anambra State branch in Oka. Our fellowship with Enugu State branch. Our fellowship with my own local branch in Igbo. You don't have half of this. You don't know what to present. It's not easy. Everybody is busy. The important thing is you have shown interest, you have shown love. And it's like a mustard seed that will grow. And you grow. Amen? So I thank you again, and I commend you, and I know you will not let us down. You will keep the flag flying. On our own part at the national level, with the glory of God, we tried our best to serve you to the best of our ability. When we got in there last year, we found naturally we had a few challenges. Challenges of assumption of office, challenges of succession. But we tried as much as possible by your support, your prayers, most importantly, your advice to get on. Most of you are going to make suggestions, and we appreciate all this. Last year, we set up a constitution review committee. Your chairman was a member of that committee, and they did a wonderful job. And a copy of that committee is already with the Senate, another copy with the House of Reps. When we came on board, we discovered that finance was one of our major problems. So we tried at least to plug a few goals. And today we are happy that we can say, to the glory of God, that most of our intakes are reflected in our accounts. We can also say that our flagship project, the guest house project, has taken off. And in January this year, we commissioned the first 2 floors. And they are using a lot of money. In fact, in March, we paid 1.3 million for the guest house. In April, we paid 1.7 million for the same guest house. And as I'm talking to you now, our FIGBC is meeting to award a contract for the completion of the whole edifice. I'm sure that by September this year, that whole edifice will be fully completed to the glory of God Almighty. Amen? Amen. So I thank you for your support. Many of you have been paying your normal subscriptions. These are part of the money. These are part of the funds that are due to us. We also get a lot of support from the investor authorities because because every graduating UI pays some money to UID accounts. But that doesn't mean that we are off the book yet. So our bill, whether at the chapter level, at the branch level, at the national level, is please come over to Macedonia and help us. This is not a fun launching event. The chairman told me that in no unmistaken terms. But I'm sorry that I have to arrive here. Not only because I'm older than him, not only because I came from the headquarters inside the local branch, but also because my younger brother and I can give instructions. So please, we should try as much as possible to dip our hands in our pockets and help this branch and help the national branch. Because we have many challenges. After the guest house project, we have a major challenge at Abuja. By the way, Abuja is the new extension of UI. UI is 95% fully built up. So a few years ago, the former vice chancellor wisely acquired Abuja, which is about the same size of the current UI. And we are started moving in. UIA has a portion of land where we intend to build a 1,000 bed space for postgraduates only. The University of Paris have made it clear that until they are 100% sure of our financial situation, we will not formally hand over that land to us. It's been mapped out, but not handed over. So we need a lot of money. So please, anything anybody can do as an individual, as a member of a corporate body, please, will appreciate it. So, national and international. Like you, we honor and hold both alive and not lost. You are aware that one of our greatest alumni, Chino actually passed on a few weeks ago. Your national president is on the National Burial Committee of this island. Only yesterday, my state, my home state, Igbo, had a day of tributes, a day of tributes for him, and visited an address at that tribute, at that occasion. We also wrote a tribute which will be published in the main brochure for the 23rd of this month. So we are representing you both in here and outside. So we appreciate what you are doing here. It's a reflection of what you are doing outside. So please, keep it up. Finally, let me appreciate the family of the workers. They have been strong, and very, very good. They didn't say, you are the abandoned us. If they said so, you will be here. May God come and talk with you. Amen. So, Chairman said, God bless you. Thank you very much.
Thank you. Before we close with a vote of thanks to lecture, and that is a tribute to Comrade Yusuf. We want Honorable Oyesegun to come and please read it out. It's a short one before we take the vote of thanks.
Stand here to read the tribute for Comrade Yusuf, my friend. Going through his biography, one cannot help but describe Comrade Yusuf as a man of the people, always service-minded. It is no wonder that his memory still lives on. He loved service and devoted an incredible part of his life and resources, personal efforts to offer assistance in all the organizations he belonged to. Thus, despite his relatively short lifespan, his modest achievements are a source of pride to his family, his friends, and former colleagues. In living his life, he touched a number of people positively, including me. Comrade Yusuf started his educational pursuits in 1971 at the worked with the former member, now PhD. Upon the first graduation, he proceeded to Niger State for his national service as a teacher at Government College in Ghana. In 1992, he joined government service fully when he worked for the Defunct Center for Democratic Studies in Abuja. From 1996 to 2000, he worked at the Public Accounts Committee, an agency under the presidency. With the revival of democracy in Nigeria, he was posted to the legislature in the office of the clerk to the National Assembly, where he served to the cold hands of death took it from us. The man, Yusuf, the brother, in whose honor we are attending this lecture, enjoying a distinguished career and a wonderful marital life. In his work life, his competence made him more work, and we all can testify to that, which is satisfactorily fulfilled. This kept him busy inside and outside the country, also as he had toured the African continent extensively and likewise the United Kingdom, Switzerland, Chile, Mexico, India, and the United States of America and Philippines. Either as part of the parliamentary delegation or secretary to committees. At one time or the other, he belonged to as many, he belonged as an executive member to more than 12 social work associations. I think he deserves a round of applause for that. Mrs. Martina, and the union is blessed with children who will also go to UAE. The man we honor today had one main principle in everything he did. Thank you very much.
Thank you very much for that. The commercial chief executive of the first years is our sister Chinoka. Is here represented by Mr. Peters, head of unit of admin department, special marshal and partnership. Mr. Peters, another invited guest is Rebecca Joe, who is a management consultant. Also recognized. Mr. Chairman, sir, my job is very simple. I would like to, on behalf of the local organizing committee, thank first the chairman for coming out of his busy schedule, the national president of UI Association, for finding time out of his extremely busy schedule to be with us today. I'd like to thank my friend, my senior colleague, Dr. Rasaq, Oyesegun, for despite the fact that we told him just gave those few shots notices, was able to have time out to give us this beautiful exposition. But as a surgeon, while I was sitting there, I was asking myself, how is it going to tackle this? This is a labor case. This is a highly technical topic. And he was able to break it down to the level that every kind of form. So, Dr. Oyesegun, thank you very much. For us, and thank you, sir, for the camera. And lastly, the high table, I'd like to thank Dr. Mrs. Hassan for also finding time to grace this celebration. Thank you very much. And now, I'd like to thank the alumni. Well, I think we are together. So I'd like to thank us, the press, friends of UI, for finding time to be present at this occasion. So thank you very much, and God bless you.
Thank you. Finally, to give us a closing prayer, and as soon as the closing prayer comes to an end, we shall all go back to this debate. There are some packages of, at least, gifts or some takeaways that the alumni executive has arranged. So, you might want to go out that way.
On behalf of the family, everyone said, viewers. Again, every time he talks, he says, he was born, raised in UI. Everything was UI. Partner actions. So, thank you all. God bless all of you. So let me give closing prayers. Please recite the material for used to. Main is just thanking God for making us alive today. So,
There are actually dates for the various meetings scheduled by the executive. Take note of them and try to be attended. 4 p.m. on those days. Thank you very much, and I would like to see you on the next occasion. We'd like to come lecturer, we'd like to come the chairman ICPC, Dr. Amatu, all the representatives of key invited guests, and all great joy. Great bearing in mind the international community.